Spring is in full bloom here in the Bay Area, but during this pandemic, many have another thing to worry about, and that is allergies. Dr. Laura Gross with Stanford Healthcare joins us now to talk about asthma and allergies during the coronavirus pandemic and how to tell the symptoms apart. I have to tell you, I have been sneezing for a good 2 weeks now. So first of all, let's talk about what asthma is.
Yeah, so asthma is all year round a really big issue that I see in clinic. Allergies and asthma are a big condition, especially in the spring when all the pollen is out. Asthma is a disease that tends to flare. So what it is a person who has asthma is prone to have symptoms when they're exposed to an external trigger. So the symptoms will come up and then go down and then come up and go down throughout the year, depending on their triggers. So with asthma, I tell people it's really important to identify your triggers. And common triggers are pollen, viral infections, exercise, cold air, food that we're allergic to. All those things can make people have flares of their asthma. And
well, you certainly have to be careful. So if someone does have asthma, what should they do to protect themselves from COVID-19?
So that's a question I'm getting a lot right now. Because the symptoms are very similar to COVID, we think maybe with, if you had a mild COVID, you could have symptoms of asthma. But another thing is that people with asthma, when we heard about COVID-19, we all worried, is asthma going to be a risk factor for getting really sick from COVID? Because viral illnesses trigger asthma. But it looks like some of the information that's coming out of New York right now shows that asthma may not be as big of a risk factor as some of the other conditions like high blood pressure, diabetes, heart disease, cerebrovascular disease, COPD, which is another lung condition. All of those are, if you look at the numbers of people that have been sick in New York, all of those things have been more risk factors than asthma, which is good news for people with asthma. So what you should do if you have asthma right now is treat your asthma. So a lot of people were asking when this first started if they should start the steroid inhalers right away, even if they weren't having symptoms, or start medication right away just to protect themselves in case they got sick with the virus. The answer is right now looking like no. If you're not having any asthma symptoms right now, just keep an eye out for your triggers and keep them away so that you don't get asthma. And if you do get flares, treat them like you normally would with your inhalers and allergy medicines. And number one, getting rid of the triggers.
So what is the best way to take over-the-counter allergy medications?
Okay, good question. So asthma is there's two different reasons that we get those symptoms that we get from asthma. So the first one is when smooth muscles surround the bronchial tubes in our lungs. It closes down when you have asthma, so you start to feel short of breath and coughing and that musical kind of wheezing sound. And then also there's inflammation on the inside of the tube. So it's important to understand that so you know which inhaler to use. You have your rescue inhaler that kind of relaxes that smooth muscle and opens up the airways, and it lasts for 4 to 6 hours. And then the inflammation on the inside of the tube, if you use your steroid inhaler regularly every day, after a couple of days, we'll start to decrease that inflammation. And then on top of that, if you have allergies, which like 80% of people with asthma have allergies, you can try an over-the-counter allergy medicine like Claritin or the new one, Xyzal, Allegra. And the best way to take those is every day as needed during when you're having a flare. So you can take it once a day or not that day if you're not feeling symptoms. And then if you're finding yourself having to use it for longer than 2 weeks, you might want to switch it out with another one. So if Claritin works for 2 weeks, you might want to switch it with Zyrtec, and then so forth. And then don't use it if you're not feeling symptoms.
So I know when my allergies start to act up, I start to feel the itchy throat and, of course, the sneezing. How can someone tell if they have COVID-19 or if it's just allergies?
Okay, so this is a great question, and one of the questions that I'm probably seeing the most, not just with my patients, but friends, co-work colleagues, lots of doctors and nurses around right now is thinking, oh my God, I have a sore throat, so I have COVID, so I have to go get tested. And it's a really valid question because, as you know, the symptoms of COVID are coughing and shortness of breath, which can be similar to allergies. So what I'm telling people is that when you're trying to decide whether or not you have allergies or COVID, you're really asking yourself two questions. It's, what can I do right now to feel better? And two, do I think I have COVID so that I don't spread it to other people? So if you feel like you're having your regular allergies and asthma symptoms, the answer is you probably are. And what you should do is try your medications and expect to get better. But at the same time, you want to also consider that you may have like a mild case of COVID and not spread it to other people. So do what we're doing right now, which is to isolate yourself and hand wash and socially distance yourself so that you wouldn't spread it should you have it. And then if you develop the other symptoms that are more likely to be COVID, like fever, muscle aches and chills, sore throat, rash, there's a rash now with COVID, nausea and vomiting, those are more likely to be some kind of viral illness than allergies. And you want to call your doctor and talk about testing if that's available. If not, then it's important to be in touch with your doctor because they're going to help walk you through it with regular visits, like phone visits, telephone visits, and office visits to make sure that you make it through the COVID period without any of the complications. And then they'll help you decide when you can go out again. Yeah.
Sure. Well, you mentioned having a rash is one symptom, and especially rashes on the feet. Those may be due to blood clotting. What can you tell us about the findings that patients with COVID-19 are experiencing this blood clotting?
I am actually seeing this really interesting finding on the feet rather frequently. So dermatologists are recognizing that maybe 20% of people with COVID have a rash, and it's taking different forms, interestingly enough. Some of them look like pox, some of them look like hives, some of them look like drug rashes, but there's a very specific rash that's turning up, at least what I'm seeing is on kind of younger people's feet. It's something called chilblains. It's a like really red, itchy, uncomfortable, like blotches on the feet that we think may be due to blood clotting, which is now you're hearing in the news that blood clotting is a complication of COVID. We don't know why, but for some reason it's either the infection or the body's own response to the infection. People are having blood clots. So you'll have symptoms depending on where the blood clot is. So if the clot is in your feet, it will show up as this rash. If it's in the heart, it could be a heart attack or a stroke. If it leaves the heart and goes into the brain. We're learning about this, and more information will come out as time goes on. But that is something we're seeing.
Well, you've definitely given us good information and good tips. Dr. Laura Gross with Stanford Healthcare, thank you so much.
You're welcome.